National Institute of Communicable Diseases says it's concerned about the increase of new COVID-19 infections, particularly in KwaZulu-Natal. The province has recorded over 200,000 infections and has over 80,000 active cases. At least 5,000 people have succumbed to the virus in KZN. Let's discuss the dire situation in that province now. Professor Adrian Purin from the National Institute of Communicable Diseases. Adrian, a very good morning and thanks for your time. So what are the trends? What have you been noticing that has you particularly worried about KZN at the moment?
Well, I think we're concerned about all the provinces, really, but I suppose given what we're currently seeing in KwaZulu-Natal, following on from the Eastern Cape, Western Cape, and now KwaZulu-Natal, is a very rapid trajectory in terms of the numbers of cases that we are currently seeing, and obviously the consequences of that are the high rates of hospitalizations and deaths associated with that. Yes.
Are we able to pinpoint, though, what has happened in that province? Is it particularly because of the holidays, because of the festive season that we saw a lot more people going there, possibly visiting family? Can we pinpoint why this has happened, particularly why we've seen the surge in KZN?
Well, it's been temporal. In other words, as I mentioned earlier, it started off, if you like, in the Eastern Cape, Western Cape, and now KwaZulu-Natal and in Gauteng, and we're also seeing this in Limpopo as well. So I think there's an overall concern, but it's probably linked to various matters such as, for example, the change in the levels. For example, we moved to level 1, which allowed for greater movement of people, association. We do note that there's probably a decline in compliance and application of the various rules and regulations that are required to prevent that. So we've probably had multiple events that has led to the resurgence. So I think although we've moved back to level 3, this obviously takes time in order to try and really, because what the events we are seeing really occurred 2 weeks ago. So we really are seeing the consequences of that currently. So I think it's really trying to really understand. So each province really has what we call a resurgence plan, and that resurgence plan works by district. So it's really important that within that district to try and understand what it is, what are the events that are really spurring on the numbers that we're currently seeing. Again, if it becomes overwhelming, then doing the tracing and tracking, quarantine and isolation may not be that effective. So I'm afraid we're going to see these large-scale numbers for a while yet, I'm afraid. Yeah.
Adrian, are we able to pinpoint particular communities, say, for example, the Indian community, or whether it's other areas, whether it is predominantly white areas or black areas in KZN where we are seeing trends growing? And I'm asking this, and I'm probably going to get into trouble for it, but, just looking at social media, just looking at WhatsApp groups as well, people saying, yes, Indian communities, this is why. It's because, you want to be secretive about this. You think COVID-19 is something shameful. You don't tell people who've been in your presence, or family gatherings mean more to you than it actually means for safety. So maybe clarify for us, because that stuff is going around. People are saying it. Let's just put it out there. Are we seeing that maybe those things hold some truth?
Not necessarily. I think if we look at some of the data, and we look at, for example, public and private sector data, and in fact, very often you would see greater numbers of cases being admitted in the private sector versus the public sector, but these can vary across province, can vary across time. So I think it's all our communities that are affected by this infection, and it may be to a greater or less extent starting off within particular settings, such as the rage events, but then it then spreads throughout the community. So I don't think we should really try and see whether or not, putting the blame, if you like, on specific events. I think it's really trying to understand those events. I'm trying to understand what are the interventions that are required to prevent transmission occurring.
Okay, so could we put this down to, and where we see different provinces experiencing their peaks at different times, could this possibly be what we're looking at in KZN, that it might have reached or be reaching or be in the midst of its peak as well?
Well, I don't think it's really reached its peak. I think it's still on its upward trajectory. Actually, compared to, say, Eastern Cape, where I think there's been a levelling off, but still the case numbers are still large. I think the Western Cape, again, there may be hints of a levelling off, but again, remember, the incidence is still fairly high. I just want to come back to your point around, which communities are affected or not. the concern obviously is that our systems become overwhelmed, whether it be the public or private hospitals are seeing large numbers of patients coming through, and the effect of that is that there are very often poorer outcomes being on the various settings in terms of oxygen supplies, care, because again, not only are it's about the oxygen supply, it's also about having the staff available, and therefore the consequences are the larger this outbreak is, the more severe a strain it is going to be on the hospital staff and on the various infrastructure that we require to manage this outbreak.
Prof, at the point where we are now, would you say that the KZN is in a crisis, at a crisis point, or possibly reaching that point at the moment, or is there hope to pull back on this at this stage?
Yeah. So I think we declared, a resurgence, in other words, the second wave. So I think that tells you that we are in a very serious situation. And again, it comes back to the fact that you need to look at, within that particular province, where are the most serious events occurring in order for us to really try and intervene. What is it that we can do? Does it mean pulling in more staff from different provinces or employing more staff, or getting better oxygen supplies? Those are the sort of key questions that need to be answered. And again, comes back to the point around, the staffing, for example.
Yeah.
I know that vaccine's been on the forefront of this resurgence, but that may well mitigate. But again, we still have to go through various steps to get to the point where we have vaccine available, vaccine being injected into the arms of the frontline workers.
Well, I suppose it's just as well then, Prof, that we see this lifeline being thrown with this first batch of vaccines expected to arrive sometime this month. And, of course, healthcare workers are first in line to get that. Just some questions this morning about how that will work. We understand from what we were told that every person, what the health minister said yesterday, every person needs 2 shots. It needs to be from the same manufacturer. It needs to be the same vaccine. You can't be taking one made by one and then the second shot from somebody else. So how will this work? And realistically then, how many health workers will we see benefiting from this first batch?
Well, I'm not sure what the actual numbers are, but I believe that the first batch, which is, I think, 1.5 million doses, I understand that should, I think, cover at least the first round in terms of the healthcare workers. Again, the logistics, I think, is going to be quite critical in order to ensure that the distribution reaches where it needs to reach, which will be the hospitals specifically. So I think that there needs to be quite detailed plans how those logistics are going to work. And then again, you need to make sure that if you've given the individual the first dose, and let's say it's 4 weeks later that the next dose needs to be given, that in fact you can ensure that the distribution works such that those doses are actually available for that second vaccine dose. And yes, I think there's been a bit of controversy around the UK approach, I think it is, where I think they're going to either mix and match or just give one vaccine dose while waiting till they can get additional doses to give the second dose.
How much do we know? How much do we know, though, about the vaccine that we are getting in terms of how far apart those shots need to be given and what happens? I mean, does it kind of wear out and you need to start from scratch if the second lot of vaccinations don't arrive here in time? Do we have that kind of information yet?
Yes, I'm sure we do, in the sense that it has gone through licensure in the UK. So, in other words, they would have looked at what is the dosing. For example, if it's 4 weeks apart, that is what they have decided is probably the optimum way in which we can ensure protection. However, again, it doesn't mean that if you only receive one dose, that by week 4 there is no immunity. It's likely that you will have some immunity, but it won't be perhaps to the same extent. We don't know that. I haven't seen that type of data, but it will certainly still provide you with some level of protection. It won't certainly disappear at all.
All right, well, it's early days.
It is effective, yes.
It's early days, so we'll wait to see what information, what the little info pack that comes with the vaccine in the box actually does say. Thanks very much there, NICD's Professor Adrian Purin. Always very handy information there. Well.